9 signs in your feet that indicate kidney failure, kidney disease. Your feet may be showing clear signs that your kidneys are at risk. Did you know that over 850 million people worldwide have some form of kidney disease? Of those, at least between 10 and 15% develop kidney failure, a condition with a high mortality rate. Kidney failure is a condition in which the kidneys have reduced their function to less than 16% of normal activity. This means they can no longer filter the blood properly. As a result, toxins and fluids build up in the body, affecting the entire system. What's most concerning is that many people are unaware they have kidney disease until it reaches an advanced stage, increasing the risk of serious complications. What signs reveal the presence of kidney failure? Is it possible to prevent kidney damage? Today, on Your Health, I will show you 9 early warning signs that can appear in your feet when your kidneys are failing. Number 1. Swelling in the feet and ankles. Swelling in the feet and ankles, known as edema, is often one of the first signs that the kidneys may be having trouble functioning properly. This symptom occurs when there is an abnormal buildup of fluid in the tissues, a direct result of the kidneys failing to maintain proper fluid balance in the body. Although it can also be caused by heart or circulatory problems, it is a very common sign in cases of kidney failure. The kidneys have the essential role of filtering the blood, removing toxins, regulating electrolyte levels, and controlling the amount of water in the body. When they are compromised, they cannot eliminate excess fluids through urine, causing the body to retain water, especially in the lower limbs, where gravity encourages fluid accumulation. The most visible symptoms include swollen feet and ankles, feeling of heaviness in the legs, stretched or shiny skin, and what's known as the pitting sign, where the skin remains indented after being pressed with a finger. There may also be abdominal swelling and difficulty wearing shoes. In more severe cases, such as in nephrotic syndrome, there is an intense loss of protein through the urine, which worsens the swelling. Treatment may include dialysis, the use of compression stockings, elevating the legs, gentle massage, reducing salt intake, and when appropriate, cautious use of diuretics, always under medical supervision. Number 2. Lunula nails. What are known as lunula nails are a distinctive visual sign that may indicate kidney function issues, especially in cases of chronic kidney disease. This condition presents as a noticeable separation in the coloration of the toenails, usually seen in the largest nails. The nail displays 2 clearly defined tones. The part closest to the base takes on a whitish color, similar to frosted glass, while the outer end can range from pink to red or brown. This color pattern remains even when the nail is pressed, which distinguishes it from temporary changes or trauma-related discoloration. Although this alteration can also be linked to other conditions, such as liver problems or nutritional deficiencies, it is often seen in people with kidney failure. Its presence is associated with uremia, a condition in which toxins that should be eliminated by the kidneys build up in the bloodstream. Noticing this sign may be crucial for early diagnosis. If it appears along with other symptoms like swelling, fatigue, or changes in urination, seeking medical advice is recommended. Only specific medical tests can assess kidney function and determine if intervention is needed. Number 3. Restless leg syndrome. Restless leg syndrome is a neurological condition marked by an urgent and uncontrollable need to move the legs, especially during moments of rest. This urge typically arises to relieve uncomfortable sensations such as tingling, inner pressure, itchiness, prickling, or even a feeling similar to electric shocks in the legs. These symptoms tend to worsen in the late afternoon and at night, becoming more intense when lying down or after sitting for long periods. Many people with this condition feel the need to move their legs constantly for temporary relief, which significantly disrupts sleep quality. Rest is often interrupted by frequent awakenings, resulting in daytime fatigue. In patients with kidney failure, this syndrome can occur for 2 main reasons. The first is reduced oxygenated blood flow to the lower limbs, which impairs proper nerve signal transmission. The second is a mineral imbalance in the body, involving elements such as iron, magnesium, and other electrolytes, which is common in cases of chronic kidney disease. Beyond physical effects, this syndrome can also impact emotional well-being, increasing irritability, anxiety, and fatigue. For that reason, if these symptoms persist, seeking medical guidance is essential. Treatment may involve mineral supplementation, lifestyle changes, and, most importantly, proper management of the underlying kidney condition. Number 4. Dry skin and itching in the feet. Dry skin and persistent itching on the feet may seem trivial at first glance, but when they occur continuously and without an apparent cause, they can be a sign of impaired impaired kidney function. These symptoms are more common than many realize among people with kidney failure and usually appear in the intermediate or advanced stages of the disease. Dry skin, especially on the feet and ankles, results from a combination of poor blood circulation and disrupted fluid balance in the body. When the kidneys are not working properly, they fail to regulate fluid and electrolyte levels and are also unable to effectively remove toxins from the bloodstream. This buildup of toxins is one of the main causes of intense itching, which can become chronic and seriously affect patients' well-being. Over time, this condition may progress to more severe stages, in which the skin of the feet becomes thick, rough, and develops painful cracks. These lesions increase the risk of secondary infections and delay healing, particularly in people with other contributing factors like diabetes or poor peripheral circulation. The discomfort caused by persistent itching can also disrupt sleep and increase irritability, directly reducing quality of life. In some people, contact with fabrics, shoes, or socks can intensify the burning or irritating sensation. If you notice these signs, it is essential to seek medical evaluation. Treating dry skin and itching related to kidney failure involves not only addressing the underlying cause but also using specific moisturizers, adjusting the diet, improving kidney function, and in some cases, taking medications to relieve itching. Number 5. Foot infections. Frequent or slow-healing infections in the feet can be an important warning sign regarding your kidney health. In people with kidney failure, blood circulation tends to be less efficient, especially in the lower limbs like the feet. This reduced blood flow results in less oxygen and fewer nutrients reaching the tissues, weakening the skin's natural defense against infectious agents. Additionally, the immune system is compromised by the buildup of toxins in the body, making it more vulnerable to infections. Feet, being far from the center of circulation and often exposed to friction, moisture, and heat, are easy targets for the growth of fungi and bacteria. Some of the most common infections include toenail fungus, onychomycosis, athlete's foot, tinea pedis, and wounds that, due to poor healing, may develop into deep and painful ulcers. In more severe cases, these wounds can become infected and lead to serious complications, including the need for hospitalization. If your feet are often injured, have wounds that take a long time to heal, or get infected easily, seek medical care. The earlier the problem is identified, the more effective the treatment will be. Proper foot care, good hygiene, comfortable footwear, and managing kidney function are essential for preventing worsening infections and protecting your overall health. Number 6. Tingling, numbness, and burning pain. Abnormal sensations in the feet such as tingling, numbness, or burning pain may seem like minor discomforts. However, when they occur frequently, they can be a sign of peripheral neuropathy related to kidney failure. This type of neuropathy is mainly caused by poor blood circulation and the presence of toxins that the kidneys are no longer able to eliminate properly. These toxins affect the nervous system, especially the peripheral nerves that control sensation in the feet. A condition known as uremic polyneuropathy is quite common in patients with advanced chronic kidney disease. It is characterized by progressive nerve damage, resulting in loss of sensation, sharp tingling, constant numbness, burning sensations, and even severe pain. In many cases, patients report that symptoms worsen at night, disrupting sleep and rest. This nerve damage also increases the risk of injuries, as the person may not feel wounds or excess pressure on the feet, making it easier for ulcers and infections to develop. In addition, persistent discomfort can limit mobility and reduce overall quality of life, leading to fatigue and anxiety. It is essential to seek medical help when these symptoms appear. Early diagnosis and treatment of uremic polyneuropathy can help slow disease progression and reduce the impact of pain. Ongoing care should include strict kidney function monitoring, possible dialysis, specific supplementation, and pain management with neurological and clinical support. Number 7. Foot ulcers. Foot ulcers are open, deep, and often painful wounds that tend to appear in people with circulation and sensitivity problems, conditions commonly seen in patients with kidney failure. When the kidneys fail, the buildup of toxins in the body and poor oxygen supply to the tissues weaken the skin and reduce the protective sensitivity of the feet. This means the person may suffer small injuries or trauma without noticing, which favors the development of ulcers. These wounds heal slowly, and if not treated properly, they become entry points for infections that can spread and lead to serious complications. The risk is even greater when peripheral neuropathy is present, as patients often do not feel pain or discomfort until the wound is already advanced. Poor footwear, constant friction, and inadequate hygiene can also worsen the condition. A serious complication related to kidney failure is calciphylaxis, a rare but extremely dangerous condition in which the skin's blood vessels become calcified. This drastically reduces blood supply to nearby tissues, resulting in extremely painful ulcers, poor healing, and a high risk of infection and tissue death. If you notice wounds that do not heal, darkened skin, or painful areas on your feet, seek a specialist immediately. immediately. Early treatment prevents complications, improves outcomes, and helps preserve the integrity of the lower limbs. Number 8. Blue toe syndrome. Blue toe syndrome, also known as occlusive vasculopathy, is a condition that presents visually as a bluish, purplish, or even dark discoloration in one or more toes. This change happens due to a significant reduction in blood flow to the extremities, which compromises the oxygen supply to the cells and tissues in the affected area. As a result, cellular stress occurs, leading to discoloration, often accompanied by sharp, persistent pain. In addition to the abnormal color, other signs may include intense toe pain, muscle aches in the legs, formation of nodules, hard-to-heal wounds, and even unexplained bruising. In more severe cases, extremely reduced circulation can lead to tissue necrosis, which may require urgent medical intervention to avoid serious complications such as infections or amputations. Kidney failure plays a direct role in this condition. When the kidneys cannot properly filter the blood, toxins accumulate and electrolyte levels become unbalanced, contributing to inflammation and vascular dysfunction. This imbalance also affects blood viscosity and may increase the risk of clot formation, which further restricts circulation in peripheral areas such as the toes. If you notice persistent abnormal discoloration in your toes, seek medical attention immediately. The earlier this condition is diagnosed and treated, the better the chances of avoiding irreversible damage. Medical management may include vascular exams, adjustments in kidney function, and treatments aimed at restoring healthy circulation and preventing complications. Number 9. Gout symptoms in the feet. Gout is a painful inflammatory condition that affects the joints and can be an important warning sign that your kidneys may not be working properly. In the feet, especially the big toe, it's common to see signs such as intense swelling, redness, localized warmth, and sudden pain, often described as throbbing or unbearable. This pain may appear at night and make even light contact with a bedsheet or shoe feel intolerable. These intense episodes of pain are caused by the buildup of uric acid crystals in the joints. Uric acid is a substance naturally produced by the body, but it should be filtered and removed by the kidneys. When this filtering fails, as in people with kidney failure, uric acid levels rise in the blood and form sharp crystals that accumulate in the joints, causing inflammation, pain, and stiffness. Gout attacks can last from a few days to several weeks and often resolve on their own. However, if not treated, they tend to recur with greater frequency and intensity, eventually affecting not only the feet, but also the ankles, knees, and other joints. Over time, this condition can lead to permanent joint deformities. In addition, excess uric acid can build up in the kidneys, forming stones or causing inflammatory damage that further reduces kidney function. That's why treating gout is not just about relieving pain, it is essential for protecting your kidneys from progressive damage. If you've ever had a severe pain episode in your big toe, or are experiencing similar symptoms, don't ignore it. Proper medical care, including lab tests, dietary adjustments, and appropriate medication can help manage uric acid levels, prevent future flare-ups, and preserve long-term kidney health. Ways to keep your kidneys healthy. Drink water regularly. Staying consistently hydrated is essential for your kidneys to function properly, to filter your blood, eliminate toxins, and maintain the balance of electrolytes. When you drink too little water, the volume of fluids in your blood decreases. Your kidneys work harder but can't eliminate everything effectively. This may lead to excessive release of myoglobin, a protein released by muscles when there's muscle damage, which can block the nephrons, the filtering units of the kidneys, and cause harm. The ideal amount of water depends on your sex, weight, physical activity level, and the temperature of your environment. Generally, it is recommended that women drink at least 9 glasses of water per day, and men 13 glasses, although this may vary if kidney issues are already present. Exercise regularly. Physical activity helps control major risk factors like high blood pressure and diabetes. In hypertension, blood vessels, including those in the kidneys, become narrowed, restricting blood flow. In diabetes, excess glucose damages the nephrons. In addition, physical activity improves overall blood flow, strengthens blood vessels and arteries, and enhances circulation to the kidneys. Experts recommend at least 150 minutes per week of moderate exercise for healthy individuals or those with chronic kidney disease. Watch your diet. A healthy diet reduces the risk of chronic conditions linked to kidney disease such as high blood pressure, diabetes, and heart disease. Choose lean proteins, whole grains, plenty of vegetables, leafy greens, fruits, and healthy fats. Dietary patterns like the dietary approaches to stop hypertension, DASH, and the Mediterranean diet are excellent models to follow. It is also essential to reduce or avoid added sugars, saturated fats, and ultra-processed foods. Pay close attention to sodium intake. Ideally, consume less than 2,300 milligrams per day. If you already have kidney disease or high blood pressure, this amount should be even lower. Maintain a healthy weight. Keeping a healthy weight is vital for kidney health. Being overweight or obese significantly increases the risk of chronic kidney disease and complications such such as gout, anemia, and bone disorders. People with a body mass index equal to or above 35 are at a much higher risk of developing kidney disease. To maintain a healthy weight, improve eating habits, use moderate portions, avoid high-calorie drinks, replace calorie-dense foods with more nutritious options, cook at home, and engage in regular physical activity. Monitor your blood sugar levels. Diabetes is the leading cause of chronic kidney disease. It can lead to diabetic nephropathy, which, if it progresses, can result in end-stage renal disease. To prevent this, it is crucial to keep blood sugar levels under control, take medications exactly as prescribed by your doctor, follow a proper diet, engage in regular exercise, and aim for about 8 hours of restorative sleep each night. Control your blood pressure. Over time, high blood pressure damages blood vessels, including those in the kidneys, impairing their ability to properly filter the blood. Uncontrolled high blood pressure can accelerate the loss of kidney function. To keep your blood pressure under control, take medication as prescribed by your doctor, follow a low-sodium diet, use stress management techniques, and exercise regularly. Avoid frequent use of over-the-counter painkillers. Non-steroidal anti-inflammatory drugs, NSAIDs, when used frequently and without medical guidance, can harm the kidneys. They work by blocking prostaglandins, hormones involved in pain and inflammation, but these hormones also help dilate blood vessels. When they are blocked, blood flow decreases, including in the kidneys, which may lead to kidney failure. Avoid using these medications for more than 10 consecutive days, and never exceed the recommended dosage. If you have fever or pain, keep usage short-term. If you suffer from chronic pain or arthritis, talk to your doctor about safer alternatives. Stop smoking. Cigarettes and tobacco products are very harmful to the kidneys. Smoke contains toxic metals and substances that damage the nephrons even in small amounts. Regular smoking worsens kidney damage. To protect your kidneys, quitting smoking is essential. Medical support, nicotine replacement therapies like patches, and support groups can be very helpful. Consider getting kidney function tests. Chronic kidney disease often shows no symptoms until damage is already advanced, which makes early diagnosis difficult without testing. If you have risk factors such as high blood pressure, heart disease, diabetes, or a family history of kidney disease, consider getting your kidney function checked. These tests include blood and urine analysis. The estimated glomerular filtration rate measures how well the kidneys are filtering. The albumin to creatinine ratio in the urine checks how much albumin is leaking into the urine. With early diagnosis, it becomes possible to begin effective treatment, including lifestyle changes, medication, dialysis, or transplant. If you notice any of the signs we covered today, don't wait. Talk to your trusted doctor or consult a kidney specialist. Taking care of your kidneys is simpler than it seems. Staying hydrated, eating well, exercising regularly, and managing existing chronic conditions are key steps. Thank you for joining us here at Tu Salud. Take care of yourself, take care of your kidneys, and we'll see you in the next video.